Hello, everybody. This is Dr. Michael Beebe with Arete Chiropractic, and I am here talking with Brendan Carney of Acupuncture North. Hi, Brendan.
Hello, good morning.
Good morning. So we get a chance to have a really casual conversation. We're doing a collaborative business series, and we're going to be talking about each of our businesses, what we have to offer the Seacoast, and then as we start to come out of this pandemic and slowly reopen New Hampshire, what we're going to be doing to keep people safe, make sure we're limiting the spread of infection, and then what our vision is for the people of the Seacoast and how they can treat their health proactively and preventatively. So Brendan, introduce yourself. Tell us a little bit about Acupuncture North and how you got into doing what you do and what it is that you do.
Sure. So thanks a lot for having me. Um, I moved to the Seacoast area in 2017. I've been practicing some type of energy medicine and acupuncture for over 10 years. I started kind of studying acupuncture in 2005 and graduated school from the New England School of Acupuncture in 2008. That's down in the Boston area. I was really fortunate to have the opportunity to teach acupuncture at Harvard Medical School. Was right out of school, fresh and green. I got a job working at Brigham and Women's Hospital, which is Harvard's teaching hospital. And I worked in a collaborative environment there with over 20 different practitioners, including chiropractors, massage therapists, acupuncturists, physical therapists, occupational therapists, psychiatrists, neurologists, medical doctors. It was this giant team of collaboration.
All the people.
And that spring-loaded my growth. I mean, I was like thrown into all these practitioners with over 10 years of experience, and I had no experience, so I was really lucky to have that happen to me. My background comes from exercise science, and I was an athlete in college. I played basketball, actually at Colby Sawyer College, which is in New Hampshire. I'm from New Hampshire, from Hanover, New Hampshire, and went to Hanover High School. As I like to call it, upstate New Hampshire. But I'm in love with the Seacoast. I love being here. And really the reason why I got into acupuncture was because my first job out of college was working in marketing for a basketball marketing company. It's a sports and apparel company that's called And1. And I was traveling across the United States, and in college, it was like the most amazing job. I couldn't imagine like ever having a different job. And then quickly I learned that through the business world, not everything is quite so glorious as it seems. And I was working representing large companies like Frito-Lay and other PepsiCo brands. We had like a collaboration marketing with them. So basically I was helping to sell more soda and more chips, which like didn't really necessarily start to align with my values as I was like a 20-year-old kind of figuring out my life and how I wanted to live my life. So I started to study meditation and Eastern philosophy. I started to practice yoga, and I started martial arts. I started in Chinese Kung Fu and Tai Chi. And through that, just grew an interest in like the holistic nature and health nature of myself. And I decided if I was going to have a real purpose and be aligned with who I was, I wanted to be able to help people. And so I had never had acupuncture. I always had an interest in it when I was maybe really young. I had 5 to 7 years old. I distinctly remember watching a special on National Geographic on China and on acupuncture. And I remember seeing like this person with all these needles, and this other person was sleeping on a bed of needles. And I was like, that's amazing. I'm like super interested in that. So that was like always had planted the seed strangely. I kind of forgot about it. And then like this memory like surfaced as I came back to acupuncture. Then when I was in high school, I had this weird kind of transcendence experience with this Toltec Healer. So the Toltec system is a system of energy medicine that comes out of Mexico. And I was an athlete, but I always dealt with a tremendous amount of anxiety. And so my mother was like, well, why don't you just try this? And so she put me on her table and she put these stones all over my body. And she did this meditation with me that basically sent my mind out in my like body or soul or energy, whatever you want to call it, out into the stars. And then like put it like back in my body. And like, it was like truly the first time when I was in high school that I had like zero anxiety and wasn't nervous at all. And then I looked at her pamphlet that she had there, and I saw all these trainings. She had like this long list of trainings, and I was like, well, I'll never do that because it's way too much. Years later, I found her and I thanked her, and I looked at all the trainings, and it was a bunch of like she had done a lot of work, but it was a lot of weekend workshops, and I had learned so much of the medicine that she had. So it's just funny how these experiences kind of sprinkled throughout both my childhood and high school, and then, learning and after college all came together. And like I said, I'd never had acupuncture, and I applied to acupuncture school, and, I got in, and I was like, yeah, okay, I'm just going to go. And my mom was like, yeah, maybe you should try an acupuncture treatment first. And so I had one treatment, and then I was like, all right, I'm good. And so then I just kind of leaped, and it felt right. You trust that gut intuition. And so now I'm just super psyched because I get to go to work every single day, and I get to be in alignment with my purpose, which is really just to help people. That's what my purpose is.
Yeah, and you do an amazing job. I know that we've co-managed a lot of patients and referred patients back and forth, and with both the upper cervical chiropractic care and then the acupuncture, people get better faster. And my patients rave about the work that you do. Talk about the like what a regular visit looks like in your office.
Sure. So there's a couple, there's lots and lots of reasons that acupuncture, people would seek that type of care. So I offer traditional acupuncture and more in-depth hands-on techniques, which are kind of associated techniques along with acupuncture. So even though Acupuncture North is my business name, it almost isn't a fair representation of the amount of modalities and the type of skills that I have developed as a practitioner. And that's largely influenced by teaching and being in a collaborative work environment. So one of the biggest benefits to coming to see a practitioner like me is that I have the benefit of time. Of course, most people pay for my time, which is nice for me. Acupuncture doesn't have as high an insurance rate coverage as chiropractic. I would say now it's probably cresting around like 50% of the patients that I see have insurance coverage. But anyways, so really, when you go to a doctor, they don't really have the time to listen to you and to do an in-depth overview, an in-depth health history, and to try to figure out, well, are there systems in your body, internal medicine systems like chronic inflammation in your digestive system or throughout your body that are influencing how you feel and influencing how you function? Is there an old injury that is affecting you in other types of ways? The classic example that I love to illustrate this is a baseball pitcher that I saw who first hurt his hand in high school and was out his junior season. Then he came to me. He was a pitcher at Wake Forest, and he was having this terrible shoulder pain. People scoped it, they MRI'd it, they CAT scanned it. He had a couple of bone spurs, but everything was intact. He didn't have any tears, and they couldn't figure out, well, why it was that he had pain. So we traced the injury to the original source of dysfunction. Because the hand is mostly connected to the shoulder, we don't necessarily think about that, right? In orthopedic medicine, they try to piecemeal and look at specific factors rather than general or more global factors. But the connective tissue and the muscular tissue and the way that our bodies move, of course, are connected. So we ended up treating his hand along with his shoulder. And then, he was young and healthy and vital, of course. But within 3 visits, see you later, he had no more pain, back to Wake Forest, and he was throwing hard.
Nice. Yeah. And I've experienced your care, my patients have experienced your care, and you do take that time to really dive into not just what the problem might be presenting as, but what might be some of the root cause. And that's so important in healthcare in general, and similar to why I got into upper cervical chiropractic care, because I want to find out not just why is the lower back hurting or why is the neck or shoulder hurting, but why has that happened in the body and what can we do to prevent that from recurring in the future. And a lot of that, for our perspective at Arete Chiropractic, stems to the central nervous system and the spine. And when we evaluate a person, similarly, we take that time to bring a person in, go over a complete health history, and then do a spinal exam and see, is their primary complaint, and the top things that we see in our office are headaches, neck pain, and head and neck injury, because we specialize in that cranial cervical junction and how this area then affects the biomechanics of the spine all the way down. And we see, do you have a misalignment in that upper neck that's contributing to the primary symptom or complaint that you're having? And oftentimes, if we correct that head and neck relationship, it helps the biomechanics, helps the joints move better, which frees up the interference from the nervous system. And then the nerves can fire better to control the function of the body. And everything is controlled by the central nervous system. And at that point, then if there's more of an extremity issue or a gut issue or a movement pattern issue, that's really then when we flip it over to people exactly like you or yourself. Because oftentimes it does take a team approach to get a body completely well. You know, that's how I use my healthcare. But with Arete Chiropractic, we really focus on that head and neck and how the central nervous system is so vital there, because that's exactly where the brain talks to the body. Body's got to talk back to the brain. Every single nerve in your entire body has to pass through right here. So we clear out this area, rebalance that central nervous system, and it helps the body work better. And it's just really wonderful to see how we can help people feel better and you know, make their bodies a better place to live. One of the things that is really on everybody's mind right now, Brendan, is COVID-19. And as we start to slowly reopen New Hampshire and people start to seek out either practitioners, because as we've been staying at home, our bodies are starting to talk to us, we're having different ergonomics, we're outside of our normal routines, and pain and problems are coming up, and or people are starting to realize how important it is to focus on keeping a body well and not only preventing and managing disease, but how do we increase health and wellness so that our bodies are more resilient. And so as people are starting to look for ways to help their body, what are you doing as we begin to reopen to help keep people safe and limit infection? And then what's your vision for the Seacoast?
So obviously, the pace of my practice has slowed down. So in a more classical acupuncture setting, it's really convenient for me because I can see more than one person at the same time. And that doesn't, in the Western setting, in Asia, it's much different. You might walk into an acupuncture clinic and there'd be 15 people in the same room.
Right.
But in most acupuncture offices, you're separated in a different room regardless. So the pace of how I'm seeing people has slowed down a lot. And in part, that's to keep the kind of cross interface of people at a minimum. And of course, acupuncture is a clean technique. It's not entirely sterile because we don't take the time when you're inserting an acupuncture needle to sterilize every single part of the skin. We take the opportunity to make sure that things are clean, but sterilization is really regarded more for surgeries. It's extremely safe. But at the same point in time, we want to make sure that as a practitioner, I'm wearing the appropriate amount of protective equipment, for myself, as well as whatever makes the patient feel comfortable. And in between each patient, that everything is sterilized and cleaned as well as possible. So that goes for all high touch surface areas, as well as any kind of treatment or exam table, as well as making, of course we use one-time disposable needles anyways, but just being and taking that cleanliness and sterile process to the next level as highly as we can. And it's extremely safe when practiced in that manner. Of course, with masks and wearing gloves for treatment, there's really not a whole lot of issues that I foresee with that.
Yeah, and I've been to your practice. You have a very clean waiting area, and then people head into treatment rooms. It's a single treatment room, and it's just you and that person. And again, wearing the personal protective equipment that everybody can have. I think that's a great way to keep people safe. At Arete Chiropractic, it's very similar. So our reception area, we've spread the chairs in the reception 6 feet apart. People are welcome to also wait in their car, and then they can be called into the practice if they want to limit their exposure. We do have separate and private treatment rooms. Everything is being wiped down and sterilized between each patient. So all the tables, the benches, the high touch surfaces. You can request that we wear gloves if that would be making you feel most comfortable. And then we also take the temperatures of our staff every single day that we're practicing, making and closely monitoring our health, making sure that no symptoms are coming up in any way. We've actually been tested with a blood antibody test, and none of us have any COVID antibodies, and we will continue every few weeks to retest ourselves, just making sure that we're as we have as much information as possible. And then if somebody does have a comorbidity, or if they're taking care of a loved one who's in a higher risk population, then we have a special populations appointment where we'll further limit the number of people in the office to even reduce risk and exposure. So there's a lot of things that we're doing to help things be as safe as possible, and also help people feel as comfortable as possible as we start to reopen. And we have been open throughout this entire process because chiropractic is an essential healthcare business, and we've been able to be open, but again, with a much reduced schedule. And we're starting to see that schedule pick up as people's need increases because they haven't been taking care of themselves as much as they traditionally do. And so we're still trying to manage that increased demand with making sure that everybody is as safe and comfortable as possible. And one of my big visions for this time, as we begin to start to reopen New Hampshire and really look to how we can not only prevent disease, but improve and enhance our own health so our body is more resilient, is really empowering people to know that you don't just have to hunker in your house and wait for a vaccine. And there's so much more that we can do to support our body's natural ability to fight off any kind of pathogen or nasty bugs, and boost our body's immune system. There's lots of foods that we can eat that will decrease inflammation or increase the reserves that our body has. There are, healthy sleep. Getting 8 hours of sleep is proven to increase the immune system. Drinking plenty of water, exercise, acupuncture to decrease the sympathetic nervous system. So that sympathetic nervous system is that fight or flight nervous system. Parasympathetic nervous system is that rest and digest nervous system. Acupuncture, when you get work done, increases the parasympathetic nervous system control, decreases the sympathetic nervous system. So that sympathetic nervous system is that fight or flight. It actually, when you're under sympathetic dominance, it shuts down immune pathways, versus when you're in parasympathetic, it's actually facilitating or increasing immune pathways. With chiropractic, making sure that our central nervous system can coordinate and control all of the body functions, because again, your spine houses that central nervous system. And it's never been more important to make sure that we're not just preventing disease, but we're actually helping a body be more resilient so our immune system can be as healthy and vibrant as possible. And I really, have the vision for people to take control of their own health and feel empowered in that way, because we need to move away from the fear of living in the world right now, and start to be able to interact with one another. And that's really my vision for this. And I think that your practice and our practice are two resources for our community to reach out to so that they can feel empowered for their health.
I can't agree with you more. I think that there are certain things in a more traditional medical setting that you can measure, right? And we tend to, as a society, place all of this important on like, well, how can I measure this immune markers in my blood system, or can I measure this inflammatory marker, or what, these comorbidities. But it's things that are harder to measure, like your sympathetic and parasympathetic balance, or your mental health, for instance, which, I think we're in May right now. It is Mental Health Month, I think.
Yeah.
Which, when you do receive care, and we've been in this protective bubble, and there's been so much fear and so much unknown, that when you do step back in and receive care, there's all this gratitude and there's all this unmeasurable effects, but you feel it as an individual, like, wow, like that was really amazing. And I know that we've talked and you've mentioned that as you've been able to see people are just so thankful for the care that they're receiving. So with as many hardships and, economically, and all the stress and being bound up, there's also a lot of gratitude. And so I think that part of my vision for the Seacoast is just to continue to try to bring that to me as I get back into work and as I begin to see people, and to try to nurture that and spread that kindness and that gratitude.
Yeah,
which transforms into health and immunity and strength, right?
that's
It's there.
yeah.
It will come.
Excellent. I couldn't agree with you more, Brendan. Thank you so much for spending your time and
Thank
energy
you.
having this conversation.
Great to talk with you.
Good to talk with you too.